Well, up first, let's take a look at India COVID numbers. And nearly 15 lakh COVID tests were performed in the last 24 hours, taking the total number of tests conducted since the pandemic began closer to the 7 crore mark. In this period, that's the last 24 hours, 86,052 new cases of coronavirus and 1,141 deaths have been recorded. The total number of COVID cases in India have now crossed 58 lakh, of which 9.7 lakh are active cases and around 92,000 are deaths linked to the virus. In the last 24 hours, over 80,000 people were discharged after receiving treatment. Let's take a look at the top 5 states affected by coronavirus in the last 24 hours. And as you can see there, Maharashtra leading that list of the most affected states. Now, our big focus on the show today, challenge trials that are being planned in the UK. Now, according to reports, London is to host the world's first COVID-19 human challenge trials. Now, what are challenge trials? This is in which healthy volunteers are deliberately infected with coronavirus to assess the effectiveness of the experimental vaccines. The UK government-funded studies are expected to begin in January at a secure quarantine facility in East London. This is according to reports that are appearing in the UK. But what about the ethics and risks involved in conducting such a study? Now, US-based advocacy group One Day Sooner has been campaigning for challenge trials, arguing the world can't wait so long for a vaccine with thousands dying every single day. They say whatever will help quicken the process should be done. About 2,000 potential volunteers have signed up for the challenge studies in the UK through One Day Sooner. Well, to talk more about this, we're now joined by Dr Sayantan Banerjee, infectious diseases expert and a former consultant with the WHO. And Doctor, you're somebody who actually supports the challenge trials. Tell us, why do you feel it's so important? And for our viewers, explain just what is it?
Gary, I was working with the World Health Organization and I am consistently advocating for early availability of COVID vaccines. Okay, so basically my views are we have to have a safe and effective vaccine as early as possible, because with the lockdowns getting lifted and public transportations opening up, the transmission rates in countries like India and other developing countries with high population density is going to increase exponentially. And there are emerging evidences of repeated infections. So there will be second and the festival seasons are coming. So in West Bengal, it will be the Durga Puja, and everywhere else it will be Ganesh Chaturthi and the Diwali is coming up. So we are about to see a surge of infections if we don't have the vaccines out early. Now the issue is whether we can have the vaccines early through these standard phase 3 trials or not. See, human challenge trials and phase 3 trials have a small difference, and it's a significant difference. And you will be surprised to know that the topmost vaccine experts of today, we have all, being an infectious disease expert, I have grown up reading Sir Stanley Plotkin's vaccines, book of vaccines, which is regarded as the Bible for all the vaccinologists. Sir Stanley Plotkin, who is 88 years old and is regarded as the godfather of modern vaccines, has come out open with the favoring human challenge trials. So recently we had an international symposium conducted by the Indian Council of Medical Research that was at the end of July, where Sir Stanley Plotkin clearly said that he is in favor of human challenge trials for fast-tracking vaccines, and that is on record and available in the website of ICMR and the Twitter handle of ICMR. Then if you consider the best vaccine candidate today is the Oxford vaccine candidate that we have, and the director of the Edward Jenner Institute, who is also the director of this vaccine project, Professor Adrian Hill, he has repeatedly said that phase 3 clinical trials are well and good, but this is much more time-consuming, much more resource-intensive, and traditional phase 3 trials may take years to give a good result. So he has also advocated in the favor of human challenge trials.
Right. So, Dr. Sayantan, there you made quite a compelling case for the challenge trials, and you clearly feel that the benefits far outweigh the risks. In fact, you're also willing to volunteer.
See, basically, the idea is every day close to 10,000 people are dying of this virus, throughout the world. The official statistics is close to 6,000 plus. And we believe we are missing out a lot of deaths in many countries. And things will be worse when the developing countries open up after the lockdown. Okay, so what we consider is if even if we have the vaccine fast tracked, at least one day earlier, we could be able to save 10,000 lives. And if we do this human challenge trial, we will be definitely able to accelerate the vaccine process by a few months, if not like 3 to 6 months. And 6 months means 118 to 10,000. So it's a huge number of lives saved. Number one. Number two is we will have a very strong data on the correlates of protection and the natural history of the disease. So human challenge trials in a controlled environment is a wonderful avenue for looking into the vaccine.
All right. Well, thank you so much for speaking to NDTV. And those challenge trials, according to the reports in the UK, are planned for January.